Okay, so the definition of what is complementary therapies, and the National Center for Complementary and Integrative Health defines them as healthcare systems, practices, products that are not normally considered to be conventional medicine. Traditionally, this kind of looks like herbs and acupuncture, but it can also encompass new technologies and emerging therapies, and I'll be touching on both today. In the terms complementary, integrative, and alternative therapies are often used interchangeably, and they are usually, and they're continuing to evolve. But the general idea is that complementary therapies can be used alongside conventional medicine, whereas alternative therapies would be used instead of. And for the purposes of this talk this afternoon, I will be talking about complementary therapies. So these would be things that you might be able to use alongside conventional medicine. And first, I wanted to mention the presence of a biased medical system. So most complementary and emerging therapies have limited, rigorous data, and herbs and supplements are not regulated by government agencies the way standard medications are, like by the FDA. This doesn't only put into question the safety of some herbs and supplements, but it also allows manufacturers the ability to market or make claims about treating conditions that may not be founded in evidence. Also, many supplements and emerging therapies can be expensive, so this really limits a certain part of the population to, even if these supplements are effective, it really limits the availability to some populations. Another thing to mention is the lack of funding in women's health in general, which many of the conditions I'm kind of touching on today fall under. And the medical establishment's systemic failure to take women's health concerns seriously. And this leads to a lack of adequate training, a delay in diagnosis, and maybe unnecessary treatments. But in short, all of the therapies I'm talking about today need more research, and it's really anecdotal evidence that we can rely on for many of these emerging therapies in women's health and pelvic floor medicine. So that's my soapbox. We're going to go into the first condition tonight, which is female urinary incontinence, which kind of encompasses stress, urge, mixed, and sometimes overactive bladder. I kind of clumped them all into one condition. And I wanted to first mention that the first-line therapy for female urinary incontinence is looking at lifestyle modifications, like monitoring fluid intake, and this should be a review. But also a number of other first-line therapies are focusing on the pelvic floor, maybe weighted cones or biofeedback. And I wanted to mention these because some of these might feel like complementary therapies, but really they are the standard of care and sometimes are overlooked as a first-line therapy. And to circle back to kind of why I'm talking about complementary therapies today is that in our practice, we have found success in taking a step back, in looking at the whole picture, looking at a patient's diet and lifestyle, stressors, and kind of starting at the basics. And we found a lot of success versus kind of jumping straight to a medication. So this is why I'm passionate about this subject, because I've seen a lot of success in it and why I'm up here talking about it. So there are a number of emerging therapies or kind of specialty therapies that are available to treat female urinary incontinence, but I'll be touching on the last two, vulvovaginal laser therapy and PRP, because those are two that we do in our office. So vulvovaginal laser therapy, there are many different types of energy-based devices like fractional microablative CO2 and radiofrequency laser. But most function similarly. I'm sure you've had reps come to your office maybe, or if you don't already have one in your practice. But they deliver a fractional dose of laser energy, which causes micro-injuries to the vaginal tissue. This then promotes this will stimulate growth factors and increase collagen production, which can remodel the vaginal tissue and improve laxity.